Hi, Rowena. It's great to see you again.
Hi, Gracie. Thanks for following up with me.
Yeah, of course. I know we've met, but just as a refresher, I'm Gracie Nichols. I'm the nurse practitioner. Can you just again verify your name and date of birth for me?
I'm Rowena Wade, and I was born on December 3rd, 1986.
Okay. So, Rowena, I know that this appointment is for a follow up after your recent medication abortion. Tell me, how did everything go?
Honestly, it was just like you described, and there was some pretty heavy gushes of bleeding and some pretty bad cramping, but kind of got all resolved within 2 or 4 hours.
Okay, understood. I'm glad to hear that things went pretty much as you expected them to. I'm going to ask you some kind of specific questions just to get a good sense of how everything went.
Sounds good.
Tell me, when did you end up picking up those mifepristone and misoprostol tablets from the pharmacy?
I did that last Monday, so about a week ago.
Okay. And how long did you wait in between taking the mifepristone and misoprostol pills?
I ended up waiting 12 hours.
12 hours. Okay. And did you take those misoprostol pills by putting them in your vagina like we'd planned?
Yeah.
Okay. How long do you think it took after placing those pills for your bleeding to start?
Oh man, it was pretty quick. Probably 2 hours.
2 hours. Okay. That sounds pretty normal. How heavy was your bleeding during that first day?
Um, like a really, really, really heavy period. I honestly had to run to the bathroom a few times, but it wasn't very long.
Okay. Did you have crampiness that came with that bleeding?
Yeah, it was super crampy. My heat pack, that was a great tip. I had to use that a lot.
Oh, I'm glad to hear at least that heating pack helped a little bit. How long do you think it took for your bleeding to taper off? How long was it heavy for?
It was probably heavy for in total about 6 hours or like half a day. And then honestly, it got really light really fast.
Okay. And did you pass any blood clots or pregnancy tissue that you saw?
There were definitely a good amount of clots, and I did think I saw some pregnancy tissue.
Okay. Again, that all sounds pretty normal to me. Did your pregnancy symptoms go away or are they getting better? I know you mentioned you were having some nausea.
My nausea is so much better now.
I'm glad to hear that. Well, everything you're describing sounds like a normal medication abortion process. Some things that I listen for are to confirm that you had bleeding start within a day of taking those misoprostol pills, that your bleeding was heavier than a normal period, that you passed clots and pregnancy tissue, that your bleeding's gotten lighter, and that your pregnancy symptoms are getting better. You meet all of that criteria, so I'm reassured that you had a normal medication abortion process that is likely complete.
That's awesome to hear.
The next step will be for you to take a urine pregnancy test, like the kind that you can buy at a pharmacy, 4 to 5 weeks after a medication abortion. I recommend that you mark that date on your calendar, plan to take that test, and if it's positive, be sure that you give our clinic a call so that we could bring you in for an ultrasound evaluation. This would be important so that we could make sure you're no longer pregnant.
Awesome. I already picked up my pregnancy test from the pharmacy, and I have an alarm on my phone to check in the right amount of time.
Great. You're so prepared. It sounds like you've got a great plan. Do you have any other concerns today?
No, I'm just really relieved that we're done with this.
Well, I'm happy that we were able to support you through this process. If there's anything else that you need, please feel free to reach out. But otherwise, we'll just plan to hear from you if you were to have a positive pregnancy test.
Thank you.
Take care, Rowena.